on the line, and that's fine. I want to start by introducing myself to the new students who I haven't met in person. I'm still not meeting in person, but have not met in person before. I'm Beth Baker. I am the Senior Associate Dean for the medical school, which means I have oversight of kind of stuff in general, and I am a general internal medicine doctor. So for those of you who are coming back, welcome back. For those of you who are on your clinical clerkships and electives, I hope things are going well. And for the new M1 students, I want to welcome everybody. I was asked a bunch of questions. I've been asked over the last week, a whole bunch of questions about COVID, coming back with COVID, clinical students, with COVID. And so I thought rather than something formal, since I sent out an email, that I could just talk a little bit and then we could open it up so that all of your questions get answered. I have some limitations on things. So one is, I am not an infectious disease expert. I do not work for the CDC, and I'm not the president of the university. So whatever I say is the best answer I can give at this very moment to the best of my ability. Stuff is changing day to day and week to week. So anything I say today may not be true in a week, and that's just the way it is. It's true right now, it's to the best of my knowledge. When questions come up, we're just going to keep answering them, and I will send out emails and periodic announcements and stuff as things change. I am really hopeful they do change, because I would like this not to be the way it's going to be all year. So that's just my preface on things. So what's happening on Rush's campus for COVID? So one thing to know is that the clinical students are being treated like employees, because you are in the clinical environment, working with residents, working with nurses, working up on the floors, working in offices. So you guys are following exactly the same rules that I have to follow when I'm in the office. And that's the way that's going to be. So we actually are treating students a little differently. Clinical students are being treated just like they're employees, as long as you're not in the academic facility, although there'll be a little bit of difference. Pre-clerkship students coming into the academic facility are going to have certain things they have to do. Everybody coming to the academic facility will have certain things they have to do. So that's one differentiation. Something that's the same for everybody. I would love in 2 or 3 months to be able to say we started being with really restrictive policies, and we've made it one step looser, one step looser, one step looser, so that we have more things going on campus. That is not going to happen if we're not all following guidelines right now. So something every single person really has to do, and the staff and faculty are just the same, is everybody's got to be super responsible right now. I need you guys, not just when you're here, I need you to wear your masks everywhere you go, aside from a very, very small bubble of people. And for me, that bubble includes my husband and my 2 kids. When I come into the office to talk to Dr. Zwecka, we both put on our masks. When I talk to Jan, we're wearing our masks. When I have a meeting with the dean, I wear my mask. So I'm choosing to make that very small. With the hope, my parents are mad at me because I was over to visit them yesterday. They wouldn't put their masks on because they're 80, but I had my mask on because I don't want to give them COVID. So you can decide. You guys, student-wise, are mostly young, healthy people. You are not very likely to get super sick. You could, but you may spread it amongst each other. And so the more people you take your mask off with, the more chances there are that there's going to be an outbreak in the student body. An outbreak in the student body is just going to make it take longer and longer and longer for us to be able to do anything, including social activities together. So I really want everybody to take that seriously, both on and off campus. The other thing I want everybody to know is you're now in medical school, or you're working for a medical school. So you are professionals. You are professionals in a medical education. That means that my expectations are pretty high. I'm going to be so sad if somebody sends me something from social media that shows 20 of you, 20 people out in a bar together, that even if it's outside with no masks and all sitting next to each other, because that's just going to, again, it's just going to mean that we're risking an outbreak, and an outbreak's going to cause us to have to take 3 steps backwards. We already have, I will tell you guys, there have already been multiple COVID cases within the Rush Medical class and at Rush University. None that we have any confidence happened in the hospital, and most of them we know didn't happen. They had nothing to do with being here. It has to do with being young people and being exposed to other people with COVID. So it's already happening. And some of you have had it. We have several students who've had COVID, and that's, you know, that's just the way it's going to be. None of us know if we are infected right now unless you're getting tested every day, and so we're not going to know. Which means assume you've got COVID and you need to wear your mask to protect everybody else. Okay, so that's my first point. Second point, what sorts of things are we doing? So for everybody, so this is including clerkship people. We haven't been doing this up to this point, but what I want everybody to do is, if you haven't already, download 2 things onto your phone. One is MyRush. MyRush app, easy enough. Just go get a MyRush app. The other is MyRush U app. You need both of those apps, okay? When you go into the MyRush U app and you sign in, there is a little COVID-19 pass. So everybody who's coming to campus, and I would like the clinical students to start doing this too, needs to fill out this pass. Are we tracking it? Yes, we're just tracking to see if people are doing it. I'm not taking attendance with it or anything. The pass just says, do you have a fever? Do you have a cough? Are you short of breath? And if you answer no to those questions, it says you're good to go, come on campus. If you say yes to one of those questions, it says stay at home. So this is not asking anybody to do anything differently than we've been doing. But if you say yes, then it gives you instructions about, about what to do. So it's a good thing to have, and we'd like to start tracking so we know what our students are doing. And this is a university-wide thing. So let's see if I can click on it and see what it, oh, never mind. It's too complicated to do here. So that's one thing. The other thing is the MyRush app, which gets you onto the ability to order a COVID test. You can actually order it through either of those, but it asks you about your symptoms, and it gives you the ability to see somebody and to have a virtual visit, particularly if you're symptomatic and you want to have a COVID test. Okay, so those are 2 things I want everybody to download, and then I want every student and actually staff and faculty who are coming into campus to fill out the to get on this app and to fill this thing out. It literally takes 20 seconds to do. If you are sick, you have to stay home. And what we're going to follow, and this gets kind of complicated. If you are sick and you have COVID kind of symptoms, you are out for 10 days. 10 days since the symptom appeared, and 1 day after the symptoms go away without any Tylenol or ibuprofen or anything, unless you get tested. So if you are sick and then you get better and you're tested and you're well now and your test is negative, then as long as you've been out for 3 days and it's been 3 days since you've had symptoms, you can come back. You can come back to work. I'm just trying to make sure that I said exactly what the university is saying with this. So hold on a second. Yeah, but that's right. So what that means is if you are sick with COVID type symptoms, you really should get tested, because we need to know if you've got COVID or not. And it's going to make a difference for your classmates, for your office suite mates, and for everybody else. If you would like to get a test, so let's say, me, I've got postnasal drip, it's the beginning of September, I'm a worrier, so I'm worried about it, but I don't really have COVID symptoms. I can ask to be tested. I don't have COVID symptoms, so that's an asymptomatic test. And we're encouraging, I'd like every student actually to get an asymptomatic test. For the pre-clerkship students, we're going to be doing that on a regular basis. For the clerkship students, you'd have to go in and get on schedule, going through MyRush, and schedule a COVID test. And you can do that. If you say you've got symptoms, it's going to get done quicker, but you're going to have to stay home until the test results come back. If you say you don't have symptoms because you don't have COVID symptoms, then you can continue working, but it's going to take a little bit longer to get the test. You need to be honest. I don't know if you have COVID symptoms or not. You'll have to decide. I personally don't have COVID symptoms, but I have allergy symptoms, and I may decide I want to get tested because I'm neurotic about that sort of thing. And that's okay. There is going to be the start of testing for students coming into the academic facility for classes. So if you're coming to the anatomy lab, are you going to be doing a standardized patient encounter on site? On a weekly basis, a cohort of students are going to get tested, and that's going to start at the end of next week. And you'll get a little bit more from the university about that. But we're going to ask all of the first and second year students who are physically going to be on campus that week to get tested. And then we'll see how backed up it gets, and then there'll be regular testing. And that's going to be the spit in the cup saliva test, which is just newly released. And so we'll see how it measures up. It's a pretty good test, but it involves spit, so it's kind of gross. Well, not that a nasopharyngeal one is any great shakes. But that's going to be the testing that will be done. And as cohorts, we will let you guys know, when testing is going to be occurring.
Dr. Baker, real quick, I just wanted to point out that there was a question in the chat. Someone was inquiring about, is the asymptomatic test free?
All the testing is going to be free for Rush Medical College students. I'm going to put that in quotes a little because it's free. They're still going to submit a bill to your insurance company, which is, since you have your insurance through us, is through us. And we're not quite sure how much is going to be paid, if anything, from insurance. We have to sort of test this out, but you will not receive a bill. So insurance may or may not pay something out. And after that, it'll go into a place where you never see it. So yes, you can get tested and retested through Rush. Not if you go to the city of Chicago, that's different, but through Rush, and it's always going to be free for you. Employees, we're treated like employees, and I think it's free for us also. Yes? Jill or Bill, do you know? You two, I can see you on my sheet, and you're usually accurate about these things. Don't know. I think it is, though. All right.
I think it is too.
I talked a lot already, so rather than me keep talking, why don't you guys ask questions, or look in the chat, or you can chat questions, and then I can answer. Or I'd love to see some people, so you can certainly show your faces and ask me a question. Would be great also.
I can ask a question. So this might be something I email you instead about, Dr. Baker, but there's a gym that I go to that I absolutely love. It's a rock climbing gym, and it's been a place that's been really important to me in terms of staying well in medical school. And I thought it'd be so fun, and I don't want to get anyone excited before it happens, but to do like an open house with the M1 students, maybe 5 people at a time. And I guess this gets into like the bigger question, what are we expected socially to do? Obviously being responsible, but do we have limitations? And then of course, regarding the personal matter, I can just email you after this.
Certainly you probably don't want to talk about a personal matter with 500 of your closest friends. The socializing. So unfortunately at the moment, we're going to say no to any group socializing. Now, does that mean you can't exercise together if there's a couple people who are going to do that? No. Is there a magic number? 20 is way too many. 10's probably too many, but that's I'm going to go take a bike ride. And I suppose rock climbing, if you're apart and you're not together, but you can't be within 6 feet of each other, and you have to have your mask on all the time, and it has to be just a very few number. The reason we're saying no to all social events is social events involve eating and drinking. And last time I knew it, you couldn't eat or drink with a mask on. And as soon as you take your mask off, you're exposing other people to your spit and things. And that's how COVID gets spread amongst people. So it's no, and there's going to be no, it's not okay from a social standpoint for us. You can't have people over for dinner, except again, in your bubble. So if you have 3 or 4 best friends and you're from out of town, you don't have your family, this is your family, then count it as, your bubble is really your family here at Rush or here in Chicago, whether that's your biological family or your friend family, and it should be pretty small. And those people you're going to do some things with. So I understand, we're human beings. I'm not asking you to lock yourself in your apartment for the next 6 months. I've got a question from Anna about the measures being taken in the library to increase cleaning. And there are measures. So if you go to the frequently asked questions on the Rush University page, it actually, oh, except I just lost my frequently asked questions. What did I just do? Oh, frequently asked questions. It asks about, tells you about cleaning, and what they have said is, how frequently, oh, you know, it doesn't say, but they're doing the same thing. So there we go. Equipment will be sanitized once a day. Computer labs are going to be cleaned before each testing sessions, and disinfectant wipes should be available at all times. So are you telling me that there aren't enough disinfectant wipes? I can take that to the university and we will have more disinfectant wipes. That is probably something I can accomplish. I can't get disinfectant wipes to show up at Target for me to buy for my own house, but I think we can get some from the medical college. So yes, and the library is going to be open, but it's operating at reduced capacity. So if any of you have been in there, you can't sit near each other. They're restricting the number of people, and you have to wear your mask while you're in there. But they are letting people study and come into the library. Can our significant others take advantage of Rush COVID testing if they're not on the insurance plan? Anybody can get COVID testing, but it won't be free. That'll go through their insurance plan. And I don't know if, I think it's pretty affordable, the COVID testing here, but I don't know the specifics, but I know I can find out how much they're charging for COVID testing. And you can have your significant other or friend or neighbor or anybody go through the MyRush app. You can download that and you can go in as a visitor and go ahead and register and then sign up for COVID testing. COVID testing is a bit backed up, so one of our students, just for me, volunteered to get an asymptomatic test, and it's about a week delay right now to get a test. So that's for asymptomatic stuff. That's what it's gonna be. So Amy's asking me, is the medical college considering any recommendation for regular asymptomatic testing? The answer right at the moment is no. And the reason is that we're not doing asymptomatic testing for your attendings and residents that you're working with. So we're not doing that. Will we do it in the future? Maybe. And I think we're going to roll it out for the, I don't know, 800 or so university students. I think the biggest place we have a problem is when we're all in the classroom together. And so for the clerkships, as you guys know, you're no longer going into, 24 of you aren't going into a classroom together to do a case. You're doing it on Zoom. So that's been the strategy that we've taken at this moment to try to prevent spread of COVID, is by just keeping the clerkship students, away from each other. Should we be testing? I don't know. Our infectious disease people have discouraged group testing. The university people are more for it. So the reason against doing screening is only that people your age, you young people, get a false sense of security when you have a negative test. So you have a negative test and then suddenly everybody takes their mask off and tomorrow you turn positive. So their preference is that everybody assumes they have asymptomatic COVID and wears their mask the whole time. Other people take a very different approach, right? So right now we're concentrating on the classroom students, but that may change over time, and I'm happy to consider other things, but right now that's the plan for the moment. So I have seen some comments from the first year students, and rightfully so. You guys are upset that you're not being allowed to come to class. I have to be, I'm going to be honest that I became extremely concerned as 2 months ago. The plan was to do small groups just to have a decreased number and to have social distancing and to still have the basic science small groups with just less people. As we got closer to fall and we saw summer camps have COVID outbreaks, and we saw people who are having early summer school, at various colleges have big outbreaks, and we saw when people came back to campuses and went to bars, there were big outbreaks. We just decided that as a medical college, it was really our primary concern has to be for the health of our community and the health of the Rush community, and that it was just too risky to put students together all in the big room that we have, that there was just too much risk of spreading COVID right now until we get a sense of what's going on. Does that mean it's going to be for the year? I really, really don't think so, and I hope not. So what we're going to do is we're going to get the first block out of the way on Zoom, and then doing anatomy lab and some simulation in person. If everything goes well and COVID doesn't have a sharp uptick in the Chicagoland area, we may start to do some small groups together in the second or the third block. Our hope will be that as the year goes on, we figure out how to have some things in person and some things not, and we don't have a COVID outbreak. If in the first month we have a big COVID outbreak, then that's not going to happen. And so we're really depending on all of you guys to do your best, wearing your mask, keeping yourself safe so that we don't have an outbreak of COVID. And then I'm hoping we can start to bring people in to class, because I know that you guys need to get to know each other, and getting to know each other on Zoom is not an easy thing to do. It's easier when you know people already. So that's the plan there. I also want to apologize to the first and the second year classes. Evidently, there have been some glitches this week that thankfully I don't have to be as involved in as many of my staff and faculty are. I don't even have a Facebook page, so my ability to understand what's going on in the electronic world of Zoom, all I know is we've had some problems this week and that we're really working 24/7 to clear them up. And I'm confident that by next week, everything's going to be running smoothly in your Zoom groups and things. And it's not the same as being in person, but the whole world is trying to get on Zoom right now, and things get a little complicated. So I ask you guys to be a little bit patient with us while we get everything together. And to let me know if things haven't straightened out in the next couple of days, which I'm expecting they'll be perfect in the next day or two. Other questions people have? Amy, have you been getting questions from other clinical students? Either Amy, I've got two. I've got Amy Zwecka and Amy Napleton next to each other on my Zoom screen.
I haven't gotten a ton of questions from clerkship students anymore. When we first started, there was a lot of questions about what would count as an exposure and whether things were safe. And the good news is that, well, it sounds like I'll let Dr. Baker talk about what an exposure actually is, because she's got this down. But as far as PPE, we have plenty. And we've been able to make sure that everybody is taken care of, and that, you know, we've had, as far as I know, only one student who has had COVID at this point, and we're not even 100% sure where the exposure was. So, you know, so far, you know, we've been very fortunate.
On clinical rotations, right?
On clinical rotations,
while
sorry.
On a clinical rotation, because we have had a number of students who've had COVID. So this is a good thing. So an exposure, because if you are exposed, and unfortunately we currently have some students who have been exposed, exposure means you are 14 days at home, stay at home 14 days, unless you've already had COVID and you have an antibody and we think that you're immune. That would be a one-off that we would talk about. What's an exposure? Okay, what's not an exposure? I go to the office, I've got my mask on, a patient's got their mask on, you know, 2 days later, I find out they have COVID, which has happened. That is not an exposure. I was wearing my mask, they were wearing their mask, it's not an exposure. What is an exposure? I was at my friend's house, we took our masks off, I was 15 minutes inside, we sat and had a meal together sitting right next to each other. So more than 15 minutes, less than 6 feet apart, no mask on. That's an exposure, okay? So if you're living with your roommates who are in your bubble, of course I don't expect you're gonna wear your mask all day long, but if one of them gets COVID, then you're gonna be in quarantine for 14 days if you're exposed to them, which is a good reason not to take your mask off with too many people. So if you're in a classroom with somebody, or you're in an anatomy lab with somebody who turns out to be positive, and you've got your face shield and your mask, and you don't take your mask off, I mean, that's not an exposure. You might want to get tested, but you're getting tested not as an exposure where you have to go into quarantine. You're getting tested because you're asymptomatic and you feel anxious, and so you want to get tested. Does that make sense? All right, Clara asks, what are the quarantine requirements between when you get an asymptomatic COVID test and the result? So if you are asymptomatic, there is no quarantine. If you're asymptomatic and you're choosing to get a COVID and you haven't been exposed, so you just decide you want to get a COVID test, then you wear your mask just like you would have, but you don't have to be in quarantine. If you have an exposure or you have symptoms, then you're out. If you have symptoms and they're minor, and once your COVID test comes back in your 3 days, you can get back. But if you're exposed, even if you're exposed, then you're still out for 14 days, even if your test comes back. So you're going to be out for 14 days if you have a real exposure to COVID, because it can take up to 14 days for you to manifest symptoms if you're going to have them. Anonymous question. Okay. So I'm asked, how often should I get an asymptomatic test, and is it okay to get a test before I go home? I think that by the time we get to further along, I think it's reasonable for you guys to think, particularly who are going to be going home to older parents. Although if your parents are my age, that does not count as older, okay? That's still younger, maybe old-ish. But you may feel like you want to do that, and that's okay. We're still working on what's going to happen over the holidays, because many of you are in states who will be on Illinois' list or Chicago's list when you come back, and Chicago is on many of your lists. So if you're going to go home to New York or New Jersey or Connecticut, we're on your list, and so you're going to go home and you're going to have to quarantine at your house. But that's very fluid, so we're just going to have to figure that out as we work on it. But we do have plans to try to help people so that you can get home and spend some meaningful time at home and have a delayed time, have some delayed time where we can do everything virtually when you first come back. Are there plans to adjust tuition if all of the year is virtual? That would depend on what we're doing. So currently, even in the virtual world, we have the exact same number of basic scientists, the same number of clinical clerkship people. We have the same number of clinician educators. We have the same anatomy labs. We're having the same simulation, although some of them are through telephone encounters. We're having the same assessments. So everything is pretty much the same. There are a few activities that we're not doing, but we're now paying for asymptomatic COVID testing and COVID testing for 500 people. So it will depend on what our expenses are. Up to this point, expenses during COVID have been about the same as expenses without COVID. So if we find that we're saving a lot of money, then the dean might consider that. At the moment, we've not saved money, not spent a lot more money. We've been about a break even. So there isn't any plan right now to refund. But I would like to believe that over the course of the winter and spring, we'll be able to start having some of the, particularly in the spring, some of the things that we do have that are group activities. So more to come on that. And that is something that's up to the dean and the board and the president to decide. Thank goodness I don't have to decide those things. Other questions that people have as I'm going through my guidelines here. Yeah. Well, so Tim Kuzel asks a good question. I wish I had this answer. So how long is COVID going to be around? I've read a lot about it. Again, I'm not an infectious disease specialist, but I think there are two schools of thought. And one is that it's going to sort of burn itself out the way like flu mutates and changes, and pretty soon the flu bug isn't the same as the other flu bug, and this goes back to being your run-of-the-mill coronavirus, which is the colds we all get, right? So a coronavirus is a very common virus. That's one of the common cold viruses. Rhinoviruses and coronaviruses are two of the main ones. But many people now are thinking that this may turn out to be like influenza, something that comes around and comes around. Once enough of the population either gets vaccinated or has had it, it won't be a pandemic, right? It may be a disease that is like the other bad diseases that we have risks of catching, and it may be around for a long time. I think it's going to be another year before we're really going to understand that. I think the other thing we don't understand right now is how long does your immunity last? So if you've had COVID, and you are, even if you didn't think you did, but you got an antibody test and the antibody's positive, does that mean that you've got long-term immunity? Yeah, nobody knows. I know that for influenza, there's no such thing as long-term immunity. So influenza virus, as you guys will learn in your HDHR, or some of you have learned it already, it drifts and shifts. So every year the virus drifts and there's small genetic changes. And that's why we need to change the flu shot, change your immunization every year. And then certain years it shifts and there's a large genetic mutation that occurs. And when that happens, we become much more susceptible. And those are the years where we have many more deaths due to influenza and where the influenza immunization doesn't work as well. So will this be a drift and shift kind of a virus? Will it just be a drifty virus the way other coronaviruses do? And once we build up some immunity, it won't be a big deal? Ask me in a couple of years and then I'll know. But that's my best answer for you. And you will learn a lot more about it as time goes on. Can we talk about how the other programs are impacted? So programs have been really impacted, even more than us. So the beauty of the medical school program is it's 4 years. And so we can move things around, and generally speaking, we can figure out how to do things, and we've got everybody back in the clinical environment. So we have not had anybody's graduation delayed or other things. There are programs, particularly in health sciences, where they're shorter programs, where we have students who've been unable to graduate and are still trying to find their last clinical things they need to do because they got off track. And so it's affecting every college, and it's affecting probably the College of Health Sciences a little bit more than others because they have a few pretty short programs. We have programs like our nurse practitioner program where they're many of our nurse practitioners, many of them are practicing RNs who are then working on their nurse practitioner program, and they may not actually physically be here. They have a lot of distance learning. So they may be in Iowa and they may still be going to work and trying to figure out how to do their nurse practitioner rotations has been a trick, because many places that aren't central rush where we're still open, many of those outside smaller hospitals and things have restricted students. So some of them have been much more delayed than we have. So at this moment, the first and second year students weren't delayed at all. We went to a remote and we were able to keep people engaged in class. The third year, now fourth year class knows that you were delayed by March, part of March, April, May, and got back in June. And the third year students were delayed May and June, 2 months, and got started in July. So we've had delays, but we haven't had not enough of a delay to cause us to have to delay graduation. So I think all in all, we've been really lucky. Okay, any plans for same-day COVID testing? That would be fabulous. You know, unfortunately, and I just found this out today, where we've actually pulled our point of care testing is getting pulled out of the emergency room, even because there are places in the country like Texas and California and other areas where things are surging, that they have pulled the manufacturing of all those tests, and they're preferentially putting them into different parts of the country where they really feel like they need the same day testing results. So we're even restricted with our patients of the amount of same day testing we can do. As things move around, would we like to have same day testing? Absolutely, I think that would be great. UIC has, they've developed their own saliva test. I'm not sure how long it's taking, but I do meet with deans every week from other Chicagoland schools. So they're just rolling that out, and I'll see how that is working for them. At the moment, we don't have the capacity. I mean, we are a very, very large medical center and serve a lot of COVID patients. So during the peak of COVID, we were taking care of something like 20 to 25% of the COVID, the sick COVID patients in the state. And so many people turn to Rush to get their COVID testing. And so we have a large number of patients we're testing. And so it's just a capacity issue, trying to work on who should be getting which test and how often they should be getting it. If we have a concern that students are having any sort of ill health consequences from lack of testing, that would be a completely different issue. Right now, I don't have any reason to believe that that's going to have a negative impact on you guys, but we'll, each day, like I said, whatever I say today could be different tomorrow. I'll be looking very, very carefully at what's happening across the medical college. All right. Other questions? So Amy's asking, what should clinical students be doing as far as COVID PUIs go? So I'd say generally speaking, you want to avoid putting yourself at risk. And so if there's a little bit more risk with that, having said that, as long as you have appropriate PPE, it's not dangerous to do that. I think in things like pediatrics, when we get into the winter months, I don't know that we can have a pediatrics rotation if you can't see any kid with a cough or a fever, because the only kids who come into the hospital in the wintertime have a cough or a fever. So we're going to have to see. Right now, we've had an extraordinarily low conversion rate of our house staff and nurses and other people going into rooms of PUIs, and even COVID patients. As long as people are appropriately donning and doffing and wearing their PPE, the reality of it is for students is it's probably not as much the risk to the student as the risk of taking up lots of PPE. So we can't have 5 people trooping into a COVID positive patient's room because everybody's got to put on, and you cannot go in a room if you're not completely dressed the way the way everybody else is. So that's what we're working out. I'd say right now the general rule is, particularly for third-year students, is just avoid that room because there's no real reason you need to go into it. And if our numbers start going up, we will revisit that, again, with safety as our very first concern. If you are a student with asthma or some other, something else, or you think you might be pregnant, let's say, or you have a heart condition, something else, then absolutely you shouldn't be seeing any patients. So if you put yourself in a higher risk category, and you don't need to explain that, except to say that that you don't feel comfortable seeing any COVID patients, and that would be the end of that. I mean, you may share what you like with your teams, but you are not expected to share anything except to let people know. But there is no expectation that students will see COVID patients. There are students who would like to do that, and in sub-internships and other things, we're not necessarily restricting your ability to do that if it's deemed to be safe. Right now, we only have about, I think this morning there might have been 21 COVID patients in the hospital. At some point we had 270. So it's gone from way high to very, very low. So there's no real reason you guys need to see COVID patients in order to see patients. And we'll just have to see what happens as time goes on. Other questions people have? Well, I can keep talking forever, but I don't need to. So, good question. What is the current status of the RMC programs? So, Sharon is working so hard to make things work for RMC. Right now, most things are happening at a distance. Mini med school is going to be remote. Some of the high school and other grade school and things that we're doing are going to be via Zoom and otherwise remote. We are not doing the routine stuff we had been doing at Salvation Army and other things, but we're doing some reach outs and some discussions with people. And I think that's gonna evolve. That's a university level decision that's being made, and it's being made program by program. And I promise you that Sharon is absolutely doing her best to make sure that we're providing as much service as we can to those vulnerable populations who really depend on us. There's been deliveries of food and PPE and other things that some of the students, some of you guys have helped with, and I appreciate that. There has been some COVID testing that's been occurring with Liz Davis, who's one of my practice partners, and groups of physicians, and some students have been helping them. So there are different things that are happening. In general, though, again, we're restricting people going out where we just can't really maintain the social distancing and don't have enough PPE and other things to make sure that we're keeping everybody safe. So some of those sites right now, we're restricting the student rotations. And certainly Sharon will be keeping all of you guys caught up on it, and she's working to find different opportunities so people can still participate over the course of this year.
Hey Beth, can I add one thing? Just a reminder to the M1 students that the Taste of RMC fair is being hosted, yes, virtually, but it's being hosted a week from Saturday on September 12th. So at that point in time, Sharon will be able, and each of the individual groups will be able to update you on what they're able to do currently, what they hope to do as we move through this, and how they're going to adjust. So those of you that participated in the M1 Day of Service and were able to distribute flyers on what happens if you test positive and where do people go for treatment, those of you who were able to assist in distribution of masks, those types of programs will continue throughout the course of the year, as well as other opportunities. But again, for M1s, please join us for Taste of RMC a week from Saturday.
So I want to emphasize, we want to give you guys opportunities. I know you came to medical school because you want to help people and you want to take care of people, and you came to Rush knowing that you were going to have a chance to provide service to the community, and we are going to work on that. I do want to emphasize that your number one responsibility right now is to stay safe and to try to keep the whole community safe. So if you're not safe, then we're not safe. So even above trying to go out to other people, and I don't mean safe meaning I'm going to block myself in my room and never leave. I'm seeing patients, I'm going out and doing things, but I'm doing it in a safe manner. So I want you guys all to, if you can't be appropriately distanced and you don't have the opportunity to be wearing the kind of PPE that you need to be doing to be in a certain place, you just shouldn't be there. And that's got to be our first priority, because if you develop asymptomatic disease and come in and 6 people get sick, and somebody dies, that's a big deal, and we don't want to have that happen. We want to keep everybody as healthy as we can. So somebody's going to get sick and you can't help it, and I'm not wanting to blame anybody, but I do want everybody to be able to look back and say I did my best to be safe, and that's going to be the number one thing we're gonna all want to do. And again, being safe doesn't mean that you don't get something, because sometimes we don't know. I actually think the most dangerous thing you can do right now is go to Target or Jewel or Best Buy or something like that, where there's all sorts of people who, don't believe in science and don't believe that, they think the coronavirus is a national conspiracy. So be careful when you're out, because there are a lot of people who aren't paying attention to what is really necessary. And that's what's scary about being out. I actually think being in a medical center is a relatively safe place to be, because people in medical centers tend to believe that science is real, which it is. So you guys are medical students. I hope I don't have to convince anybody that science is real. Coronavirus is real, and we need to be careful. All right. So I got a question about my email and what I meant by professionalism. So what I meant by that is that I expect you guys to all follow the CDC guidelines, as we talked about. It is absolutely fair in your bubble, which I'm going to call your Rush Chicago family. There are going to be some people that you decide you're going to not wear your masks, you're not going to socially distance. It's a small number, and that's okay. Those are the people, those are your roommates, that's your family, those are your best friends, not your 20 best friends, your 3 best friends, that sort of thing. Other than that, my expectation is that you're going to wear your mask and you're going to remain socially distanced for everything you do 24/7. Doesn't matter if you're at Rush or not at Rush. And that's your professional obligation. So if you decide that you're going to go out to a big party in a park and there's 100 of you and you are all standing next to each other drinking beer, and we find out about it, that's going to be there's going to be, you're going to be cited for unprofessional behavior, and you're going to go to the promotions committee for unprofessional behavior. What's going to happen? Well, that's not, I don't make the rules of what the repercussions for things are. I present what the problem is and allow the faculty as a whole to make those decisions. But that is the obligation you've made as a Rush student, is to be a professional, to uphold that professional responsibility, which is not to put us in danger, because you're going to have irresponsible behavior outside of Rush. But does that mean I expect you to go to bed wearing your mask? No. Does that mean that I expect, you and your girlfriend or boyfriend, when you're, watching TV at night, that you have to wear your masks? No, that's not what I'm talking about. I just mean that you need to be careful, and you need to do the best that you can to keep yourself safe. Transportation I have. Yeah, so people on public transportation are particularly bad. Now, the good news is that in Chicago, at least, there's been hardly any reports of people becoming COVID positive based on being on public transportation. But I do feel that. I think, if you need to have public transportation, to go on public transportation, make sure you're wearing a surgical mask. I might even think about getting a respirator and an N95, and try to keep your distance. We don't have any particular ways to assist students. We're thinking about what that might mean, and whether limited carpooling, other things. I think that's going to be an individual decisions we'll be making. For first and second year students, there aren't that many times you need to be on campus, and so we may limit that even more for students who are having a difficult time getting here. So I think we'll talk about that as time goes on. For clinical students, you do have to be here. And I don't have a specific answer to how to get here, because anything you're going to do, even taking an Uber, has its germs in it. So I think that best you can to try to find small groups and maybe carpool with people that are in your friend bubble. And we'll be thinking about that. If you have other ideas, I'm happy to consider what they are, but I don't have any really great solutions to that problem right now. Any other questions? Okay. I think we've answered them. So feel free to email me with questions. What I'm going to do is work on putting together sort of a Rush Medical College fact sheet to go along with what the university has done. Right now, though, you can go, absolutely, if you go on the Rush University site, there's a big thing that says COVID across the top, and you click on that, and then it gets into the reentry plan. It has frequently asked questions from the university standpoint. Within there, if you have a question, there's something you can click on that allows you to put a question in if you're having symptoms, or if you had a COVID positive test or something else, and you will get answered by somebody in the university. And so that is another way. You can also ask me, you can ask Dr. Zwecka. First and second year students can ask Dr. Levin. You can ask any of the staff in the OIME, and we're happy to try to assist you also as questions arise. Okay. Well, I'm tired of talking. It's very odd to talk to a bunch of little squares when I don't get any sort of feedback, and there's nobody, everybody's got their microphones on mute and nobody has their pictures going. So I don't think I can do this anymore. Feel free again to contact me at any time, and we will be communicating as regularly as we can and trying to get some stuff before your basic science sessions and get some stuff out to clerkships too. So thank you, everybody, and good night.